Greetings from the University of the District of Columbia in Washington, D.C. I am Dr. Phronie Jackson, Assistant Professor in the College of Agriculture, Urban Sustainability, and Environmental Sciences, Health, Nursing, and Nutrition. I am the Program Coordinator for the Health Education Department. The background of my presentation is that in 2017, during the 11th Annual Health Disparities Conference, my colleagues and I, including a student, presented a poster on our HIV prevention program. The poster was entitled, "College Students Reveal How to Best Connect with Them to Conduct HIV Prevention Programs." Now, that presentation really talked about focus groups that the students did with their peers on how the peers, all the students at the university, thought was best means of connecting with them, and that was through social media. Fast forward to 2020, my colleagues and I Fast forward to 2020, the University of the District of Columbia's Faculty Senate sponsored a conference, and the theme was on retention and graduation rates. I did a presentation on Campaign 930, but it was not based on the HIV prevention related to Campaign 930. It was based on the techniques and strategies that we use to keep the students engaged in the program. What I found in my literature review and throughout the literature was a lot of the same things we did in Campaign 930 to keep the students involved and actively engaged were evidence-based strategies that universities use to keep students enrolled in college, and also not just enroll, but keep them in all the way through graduation. So the very same techniques that we were using to engage the students, not just simply engaging them around their academics and their classes, but also with social issues and health issues and the such, were keeping them in the program and actually in the university. And we compared the graduation rates of the Campaign 930 student participants to the overall university graduation rates, and we found that the Campaign 930 students actually had a higher retention and graduation rate than the university. So the evidence-based practices that we use to engage the students in the program were also useful in retaining the students in the school, in the university, and graduation. So, as we know, education is a social determinant of health. So what we have concluded in further exploring the benefits of Campaign 930, which I tend to call this the Campaign 930 phenomenon, is that the strategies that we were using that retain the students in the program and allow them to matriculate through the university up to graduation was also a way of addressing a social determinant of health, which is education. So because we were encouraging and engaging, and our work had an impact on retaining students and getting them to and through graduation, we were able to have a positive impact on education, which is one of the social determinants of health, in addition to economic stability, social community context, neighborhood and environment, the built environment, and healthcare. So the Campaign 930 phenomenon is not only that it was an HIV prevention an awareness program on campus, not only did it help to retain students and help students graduate, but it also had an impact on social determinants of health, or at least the education social determinant of health. Thank you for your time and listening to my presentation. Again, I'm Dr. Phronie Jackson with the University of the District of Columbia, College of Agriculture, Urban Sustainability and Environmental Sciences in the Health, Nursing and Nutrition Department, and I am the program coordinator for the Health Education Program. My research is on health equity, health disparities, and social determinants of health. I also study teaching and learning, and the Campaign 930 phenomenon that I have brought to you today really touches on all of that. It talks about retaining students in school and colleges and getting them through graduation. It talked about preventing a chronic health concern, HIV. We've also found that it can have an impact on social determinants of health, education, thus leading to health equity. So again, thank you for your time and have a wonderful day.